when people hear health or they hear mental health, they actually think of ill health. That when we look at health and well-being, we think of in terms of promotion, prevention, treatment and recovery, and think about that in a circular way.
Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Fergal Fox, and today we're speaking with some of the keynote speakers from the National Health Promotion Conference in Galway, focused on implementing a systems approach to mental health promotion, policy to practice. So we have a large panel of speakers around me today. They'll be all sharing their insights around the area. And first of all, I'd like to thank University College Galway for hosting us here today. To the listeners, thanks for your continued support of the podcast. If you'd like to know more about HSE Health and Wellbeing, check out our website, follow us on X or our YouTube channel, or you can register for our e-zine by emailing healthandwellbeing.communications@hse.ie. So as I said, we have a large panel around me here now. So everybody's here supporting this conference in Galway, and I'd like to welcome you all. So we have Ms. Stephanie Priest, who's the Acting Director General of the Centre of Mental Health and Wellbeing with the Public Health Agency in Canada. We have Professor Laura Shield-Zeeman, Head of Department at the Public Mental Health Trimbos Institute in the Netherlands. We have Dr. Alicia Clark, Programme Manager for Mental Health and Wellbeing with my own department, HSE Health and Wellbeing. We have Ms. Soila Redimpa, Senior Specialist at the Ministry of Social Affairs and Health in Finland. And we have Professor Margaret Barry, Professor of Health Promotion and Public Health at the Health Promotion Research Centre here in Galway. So a lot of people, you'll hear a bit more from them as we go on. First of all, Margaret, I want to come to you. You've been working with us in partnership around this conference for many years, and I know mental health promotion is your deep interest. I remember you lecturing when I attended college here, telling us all about mental health promotion. So you must be delighted you've got your own key topic as a specialty.
I am, Fergal. We're delighted to be hosting the conference tomorrow. It's the 28th in the series, and of course we do it in partnership with yourselves in the HSE, with the Department of Health and the Association of Health Promotion Ireland. And I was thinking, we have different themes every year. And the last time we had an explicit focus on mental health promotion was in the year 2000. So that's 24 years ago.
Yeah, that's amazing.
And so it's interesting to reflect on the progress that has been made in terms of mental health promotion in Ireland and internationally. But I think the focus this year is quite interesting, that we are talking about a systems approach and looking at what it means to really implement mental health promotion at a whole systems level. That's whole of government, whole of society. And this is actually, I suppose, quite different to where we were at 15 years ago when we were just trying to get the idea of good mental health on the agenda and how do we do that and how do we build up the evidence. So I'm delighted that we have our national and international speakers with us tomorrow to talk about the experience at a policy level in getting this onto the policy agenda in a real way and getting, investment in terms of what works. And also in the afternoon with colleagues from the HSE and the Department of Health to talk about, really implementing this in practice, looking at organisational and workforce capacity, because, it's made its way up the policy agenda. We have the evidence, but now we need to see the political commitment, the investment in terms of evidence-based practice. So we have an opportunity to talk about that tomorrow and to share experiences across countries. So it's quite exciting.
Yeah, that's it, sharing experience across countries. And the other key thing I'm going to pick out from what you just said there was around the systems approach, that no more than like our Healthy Ireland, our health and wellbeing strategy calls for a health in all policies approach. Your systems thinking requires a mental health in all policies approach. And that's really the kind of thinking that we're alluding to, or we're trying to figure out, because it's not simple.
No.
Can I come to you, Stephanie, first of all? You're coming over from Canada and you're talking to us here tomorrow about mental health promotion and the systems approach. How do you think you do mental health promotion in your own country? What's your reflections on that?
Yeah, from Canada, it's really interesting. And it's been interesting hearing what's going on in Ireland. And sometimes you think, we haven't got it all figured out. And I have to say that we have some things figured out and we're learning together. And there's so many things internationally that we can learn from each other is what I'm starting to hear. In Canada, we've made some progress, definitely over the last 10 to 13 years, where we are starting to look at mental health, not just treating disease or mental illness or poor mental health, but starting to look at it much more comprehensively, from an individual perspective, but also how we support communities and systems to have a change that will be sustained over time for people in their communities. So we've developed a number of tools that can help programs and communities on the ground guide the work that they're doing, help them to create evidence that they can use to design their programs for mental health promotion. These include indicator frameworks, both from a positive mental health perspective, but also from a health inequality and inequity perspective. And we're starting to see in our programs that we are delivering at federal or national level, how we can make and create better partnerships to help with scaling up some of these programs across the country, which I think is part of the challenge.
It is. We might come back to partnerships and collaborations because they do seem to be central to mental health promotion work. We've done a good few podcasts about mental health and wellbeing. Martin Rogan, the former CEO of Mental Health Ireland, said in one of our previous podcasts that mental health promotion isn't a solo pursuit, that we need the partners. We might come back to that. I'm just going to go around the houses, internationally speaking, first. I'm going to come to Laura next in terms of the Trimbos Institute in the Netherlands and your experience of mental health promotion in that jurisdiction. What do you think you're doing well there? Stephanie was just telling us that they think they're making improvements. They're investing in good modelling and trying to build evidence in good practice. From your point of view, how would you think you're getting on there in terms of your mental health promotion policy in the Netherlands?
Yeah, so like in Canada, I think we've made some steps forward and there's still a lot to learn from other countries. I think notably something that the Netherlands has done well in the last few years is the launch of its national mental health plan called Good Mental Health for All. And that was led by our Ministry of Health, Welfare and Sport, but championed by a few other ministries as well, including Education, Culture and Science, as well as Social Affairs and Employment, who really undersigned responsibility and interest in working on one of the living environments or place-based approaches in that plan, which are the neighborhood, schools, the online environment and work. So that's really instigated more national dialogue and movement towards meeting people where they are to improve their mental health. And that plan has been accompanied also by a national population mental health monitor to better be able to see what trends are going on when it comes to mental health and well-being in the Dutch population and be able to anticipate future actions that can strengthen the implementation of this national mental health plan. And I think a strength in this whole approach was that the national plan was really based on an extensive scoping phase with the field and with researchers, so that it was based on needs and on science in terms of how it was developed and what went into the plan.
Okay, so one of the things that we might come back to again is you got other departments to, as you said, undersign and kind of dedicate resources or come behind that plan. That's really important, isn't it? We'll come back to that in a minute. I want to go to our Finland representative here, Saila. Can you tell us little bit about the practice in your region?
I think we have now good structures. We have a state-level structure, interministerial cooperation group for mental health promotion especially. And also we have structures in municipalities, health and well-being promotion, and behind these are acts. And also these well-being services counties with this new structure for health and social services started last year. So the structures are okay. And also we have our mental health strategy published 2020. So it's quite new and long period 2030. It's important and it's including the suicide prevention program. So these are good things. And so we are good way to promote people's mental health. We also think that mental health in all policies point of view and mental health as a capital, as a human capital, we can invest in and we can take care of together.
Yeah, that's nicely put. Thank you. So, Alicia, back to our own shores here with the HSE. It's interesting hearing what everybody else is doing around the world. Sometimes we have this kind of international envy. We expect other countries to have it all solved. But it's just clear from the three speakers already that there's strengths and there's different approaches been taken. Do you like to tell us a bit about kind of describing some of the work that we're doing in the HSE?
I think we're really fortunate in Ireland to have a dedicated HSE mental health promotion plan to guide our work. So that's our Stronger Together plan. And this plan is really focused on strengthening our individuals, strengthening our communities in terms of increasing social inclusion, participation, but also trying to address some of the broader social determinants of mental health. We've 27 actions within our mental health promotion plan, and they're delivered right across the life stage and across our key settings. So I suppose just to give you an example of some of the work we're doing, we're looking at the delivery of evidence-based interventions and supports for parents to enhance parent-child relationships and child outcomes. We work across the education system in terms of trying to support child and adolescent mental health. And then we have a particularly strong focus on our communities and working with our community and voluntary sector to support both individuals but also communities in enhancing that social well-being and community connectedness.
Okay, so again, we might drill down in some of those, because I think when you put everybody's mental health promotion plan or policy beside each other, there's so many kind of common themes, isn't there, and shared language even. One of the points that we said we'd come back to earlier was the focus on partnership and collaboration. And in my mind, they're kind of themes and issues and strengths that we really have to focus on in the area of mental health promotion.
I think that partnership working is like a core competency for people in mental health promotion, being able to work across different sectors, make it meaningful, build trust with people, make it happen.
Yeah.
And so that skill of collaboration, partnership, working on an equal basis,
seeing other people's point of view.
absolutely, and making it relevant to the issues and concerns that are of relevance to other people, absolutely essential for mental health promotion work.
Yeah, it kind of highlights some of the issues you were highlighting earlier, Alicia, about the partners working and engaging at community level, and even the local authorities becoming stronger in relation to health and well-being.
I would add to that, as I reflect on some of our work in programming in Canada, in some of our programming, it's not federal partners that we're creating. It's really how we incent and support communities to develop their own partners without necessarily the federal government. It helps sometimes that we're there. And then what does it mean to be a vested partner so that you have a stake in what's going on? How do you create a partnership that is bringing somebody in that can help financially, but maybe also with capacity building? There's different ways. And so it's kind of a soft skill, but it is a complex thing to, I think, teach and to share out. So I'd be really interested in hearing more about that at the conference.
Yeah, and you won't get far without it. Like Margaret called it out there as a core competency. And sometimes it is seen as a soft skill. And the people that are very good at it, no more than mental health promotion, it's kind of invisible but integrated if it's done really, really well. Margaret, it's important, to be able to, it's maybe a phrase that overused, that we share the evidence. But to share expertise and learning from across countries is like just a really smart and good value thing to do, isn't it?
I think it is, Fergal. I agree with you, because we need the evidence, but on its own, it's not enough. Evidence is not on its own is not enough for policy, and it's not enough for practice either. So we've got to make sure that you can make it real, they can make it actionable. And so we talk about having the evidence, but also demonstrating feasibility, and then actually investing in what works. I think that's really key. If we have very strong evidence and we know a particular approach works and has an impact, and particularly in a long-term basis, it's very important that we invest in that and that we invest in scaling it up, because the evidence base has been strengthened a lot, over the last 30 years. And we have fairly compelling evidence now about what works. So it's really important, I think, that is translated into policy and practice. And I think we're at an important juncture here in Ireland now in terms of, the policy developments, like Alicia mentioned, in the HSE with the Stronger Together plan, and the developments that are underway in the Department of Health around a national mental health promotion framework. So this is quite an important step forward in terms of policy. And, as you mentioned at the beginning, I've been working in the area of mental health promotion since I moved here to Galway, to the university, and we've been developing, research and teaching programs here as well around mental health promotion at a postgrad level. But I think, we need to see the political commitment and the leadership around this to really get it going at a population level. And I feel we're on the cusp of that. And so that's what makes, I think, this conference particularly exciting, and why I'm so pleased that my colleagues have taken the time to come and to share their country experiences. And, we have done some research looking at the policy structures and the policy processes that are important. But also in the course of that, we undertook some roundtable discussions online with many of the people that are sitting here today. And they gave generously of their time to tell us about what works, what doesn't work. And there's a lot of commonality across that. Some things are different, but some things are the same.
Yeah, I'd like to dip into that now with the other speakers. Like the key thing that you're looking for there that I heard, and you've said a good bit there, but like we're building the evidence base. We can absolutely say that that's strengthening from year to year. We've explicit policy now. Alicia's just highlighted some of the key actions from the Stronger Together HSE plan from our own perspective. But looking across to the other jurisdictions, seeking that political support and that commitment around policy. Is there any examples that you would have said that you can bring to the table that would have had success in that area? How do you engage the politicians and communicate the need to invest in this area?
We have legislation, and we have this Act for Health and Wellbeing Promotion, and it has been very long time, over 10 years or 15 years or something like that, for municipalities. And it means also that every municipality has a structure to promote health and well-being, and it's including mental health promotion also.
So it's normalized at a local level then?
Yes, it's a normal thing.
Yes, yeah.
It's part of the administration.
Yeah.
And also now our well-being services, these counties also, this structure is important, and it's ACT. And I didn't mention before, but they also get state money the better they do this thing.
Oh, right. It's incentivized.
Yes, I forgot this. But sum of money to every citizen. And they measure these things, and the better this measure is and the results is, they get more money.
Yeah.
Yeah.
That's a perfect incentive, isn't it? So these initiatives, the overall funding stream is kind of set in stone via the legislation. There's a normalized local operational for that to do. Is there any other examples of success from getting buy-in, like even across government?
Yeah, so I think in the Netherlands, we have those local structures similar in Finland. So every municipal government has a municipal health service, which has advisors specifically focused on health promotion. Mental health promotion is a relatively new task, but they've also, through a new national agreement called the Healthy and Active Living Agreement, municipalities are getting funding to work on mental health promotion at the local level through collaboration with other departments like housing or work and income. And so that structure is now formally there. And now it's about how does that get implemented, and what does successful implementation look like in different municipalities? And can we also leverage some municipalities' experiences to inform other municipalities that are maybe...
And how new is that? How new is that approach?
That's from 2023.
All right, so it's very new. Okay,
exactly.
Yeah.
Yes.
So we have something similar, Alicia, I guess, in terms of the local authorities getting increased investment in relation to health and wellbeing. It's not always specifically mental health and wellbeing, but it is around Healthy Ireland and health and wellbeing coming in at that local focus. So that'd be the only thing I could compare it to in Ireland, is it?
That's right. And I think the advantage of that is just having that reach into the local communities, which is hugely important, and just that collaborative working between ourselves and the HSE and the local authorities. It's having that joined up approach.
Yeah. So obviously in Ireland, the Department of Health are funding the HSE where we work, but also seeing them fund health and wellbeing into local authorities has been a game changer in terms of that local community involvement and being able to address specific needs and get the local authority different kind of ways of working tuned into health and wellbeing when so much of their work impacts on the determinants of health.
In Canada, it's a little bit different and perhaps a little more complicated because the way our system is set up at the national level, we don't have the same responsibilities for the delivery of healthcare and health services like that rests with provinces and territories. So it's meant that it's been absolutely critical for us as we move forward with our mental health agendas and priorities, including mental health promotion, that we create structures with our provinces and territories to align our work together so that we're not duplicating, but really complementing each other. And I think public health, where I work, has played a really important role in doing that, because in public health at the federal federal level, we also have programs that we are funding that we can work with provinces, but also municipalities and right down to community ground level to implement mental health promotion and test it and look at the scale up and find ways that we can share that evidence out. So we may not be there as a long-term funder, but we do have a program that can start to build evidence with the focus of sharing that evidence more broadly with our partners, making partnership absolutely critical for us.
That's really interesting. Like, let's talk a bit about the things that we're talking about. We're talking about mental health promotion at a very high level and talking about structures and policy. What type of programs, when you describe mental health promotion programs to somebody, even a lay person, we may have listeners here that aren't working in the area at all. What kind of mental health promotion programs do you think, oh, now I love this area of mental health promotion. This is an area that I've been interested in.
Well, certainly when you look at the evidence from both the impact and cost effectiveness, I mean, investing in young people, the early years in schools, absolutely critical. Give everybody a good foundation for good mental health, working with new parents before the child is born, looking at, the child's development from a social and emotional well-being point of view, as well as their physical and cognitive, because that's so important. And then taking that into preschool and into schools. I think if we got that right, we'd be doing a lot. And of course, the community setting and workplace settings, we tend to think about the settings, where do we live our lives? That's where our mental health is created. So we spend a lot of time at work in our local communities. And there is, the evidence isn't as strong as in the early years, but it's growing, and I think the evidence sometimes isn't strong because the research isn't strong.
Yeah.
The interventions can be very innovative and quite powerful, but they're not being captured adequately. And then as you go through life, and I think, to see kind of as we age, as we grow older, our mental health and well-being is absolutely crucial. So for me, it means all those things.
Yeah. Everybody, everything. But you did call out the early years specifically. Alicia?
Yeah, I suppose just to give an example of one of the programs in terms of schools that we deliver on or provide training to teachers on, it's the Mind Out program, which is delivered in secondary schools, in the senior end of secondary schools by the class teacher. And I suppose this program is an evidence-based program evaluated in Ireland, and it really is focused on enhancing young people's social and emotional skills, so supporting them to develop their resilience and their coping skills to deal with the everyday adversities. And I think, the robust evaluation of that program in Ireland showed that it can have a significant positive impact on young people's social and emotional skills. And what we saw was for girls in particular, it reduced levels of anxiety, of stress and depression. So I think we can really see, as Margaret mentioned, the evidence base around mental health promotion is growing, and we've good evidence that these programs are important in the early years. So
again, you said a mouthful there, but the social and emotional skills of young people are fundamental to their mental health and well-being. So if anybody that's even not working in the area that has an interest in youth health, that's a massive protective factor.
Absolutely. And it's not just in terms of mental health and well-being, but we also see that it can have a significant impact on behaviour, but also a significant impact on academic achievement. There's good evidence that investing in social emotional learning from an early age can have a positive impact on pupils' ability to engage in learning, but also academic outcomes.
Stephanie, in relation to Canada, are you taking that focus on young people that the guys were just talking about there?
Yes, in Canada, we're doing the same, recognizing that action and intervention in the early years can have lifelong positive impacts. It's not the only area for action on mental health promotion, but it is a focus of one of our population mental health programs called the Mental Health Promotion Innovation Fund, which is unique for a number of reasons. First of all, because it acts on social determinants of health, protective factors, and risk factors. And it gives funding over enough time, up to 10 years, to be able to see results and transfer those results into the community. So we have a number of examples of that currently that are operating particularly for youth. And some of them within our First Nations Inuit and Métis communities in Canada, or Indigenous communities, who have some of the lowest social determinants of health and struggle with a number of different issues, but also have a number of strengths and assets that they can build on and that we want to support. So, for example, we've funded through the Innovation Fund an Inuit Wellness Hub for family-centered, community-led social enterprise models that can help bring children, youth, and families connected in some of the territories in the Nunavut territory. We're also funding programs for some of our newcomer communities, which have reached out for mental health promotion support. We have a program that's operating that's enhancing wellness of newcomer children, youth, and families. It's
newcomer children?
Newcomers to Canada.
Oh, yeah,
so they
okay.
could be immigrant communities, refugee communities.
It's fantastic that you've identified those priorities and you're going after them with resources. And the unusual thing, like you said, it is unique. About 10 years.
Up to 10 years.
It's not just a pilot. You're trying to do something and suck the evidence and share the evidence.
Yeah, and I think we've said many times in Canada has been sort of a nation of pilot projects across the country. So how do you move pilots, particularly in mental health promotion, which can take some time to start to see longer term results, and it takes a commitment to stay with those programs and support the mental health promoters that are delivering those programs in communities. So how you do that, this program in particular, which is run by the Public Health Agency of Canada, has had success in doing that, particularly for families, youth, and children in communities. And it's gated funding, meaning that as you go through an incubator phase, you start to build your partnerships. They're partnerships for the community, not ours, that can build out. And then we work with those communities to help them look at how to scale up. What is working, not just on the outcomes, but how do you implement these things in a way that you can share them more broadly and adapt them to different communities?
Yeah, the implementation science of these initiatives is a really, really crucial area of focus. And I suppose it's where the sustainability is going to come from. Can I come to you, Laura, in terms of that youth focus, that seems to be taken in every country? What does that look like in the Netherlands?
It's quite similar. We do have a lot of different programs for young people. There's a national program which would translate to the best start in life to equal opportunities, something along those lines. And it's a national action program from the Ministry of Health, Welfare and Sport, focused on providing support and strengthening protective factors for new families within the first 1,000 days. In addition to that, at every single level of education in the Netherlands, including higher education, there is a national structure for knowledge translation and implementation so that schools and universities and colleges have access to insights on what can I do in my school, who needs to be involved, what sort of mix of interventions should I pick, should I screen, how do I work with school psychologists, how do I work on parenting programs. So there's a number of stepped plans for different levels of education that's endorsed by the National Knowledge Institutes and our government to support schools at every level. And that receives not 10 years of financing, but 5 years of financing from the Ministry of Education, Culture and Science.
Yeah, the investment is crucial, isn't it? Soil in Finland.
Yes, of course, children and young people are very important to us. And for example, in our government program, there are several actions how to promote, for example, children and young persons' mental health and all health and well-being overall. And also children and young people are one focus area in our mental health strategy also. So there is ensuring equal opportunities, supportive environments, safeguarding vulnerable children and young people, reducing poverty and social exclusion. Also, we have in this government period, we have one new program, actually two. There is a young people, the so-called mental health package, and there is actions to improve their mental health in their daily lives. And also we have program and 9 million euros for that program. Its name of in Finnish, it's terveydeksi, and there is a little humor because it in English, cheers.
Cheers.
Yes, cheers. because there is a good nutrition and sleep and
So it's an integrated program.
Yeah,
And
yes.
9 million is for how long?
this season, this government
This
season,
government, okay.
until 2027.
Right.
And one theme is prevention on loneliness,
Right,
for
yeah,
example. Yeah.
Loneliness is a theme that comes up. You know, there was a government task force in Ireland set up specifically around loneliness. But like, to me, I guess it's an element of mental health and well-being for different population and priority groups. And I know, Alicia, one of your initiatives was targeting particularly older people, but sometimes, you know, there is a loneliness risk there.
That's right. We, over the last year, have been working on a specific program for older people, given, as you said, we know that loneliness and social isolation is a significant issue with older people. So we have worked with the University of Galway on piloting a program called Minding Your Wellbeing for older people. And this program aims to promote positive mental health and wellbeing for older people through self-care, positive psychology strategies, and a focus on resilience building. And the program, it's delivered by our health promotion officers working in collaboration with community partners such as Alone, family resource centres and community day centres. It was delivered over the course of 6 sessions, and the University of Galway carried out a process evaluation to look at really the feasibility of this type of program delivered in the Irish context. And I suppose early findings from that research is showing that, you know, it has had a significant positive effect on older people's resilience and their self-care, really positive impact around that. But I think also what's important for us at this point in time is to look at a delivery model. So as Stephanie mentioned, I think it's important that we move beyond pilot research and look at the implementation model at that national level, and also building in more robust evaluation methods to understand, you know, impact both in the short and long term.
Yeah, and I'd like to give special credit to, you know, those community partners that you're talking about. I always want to give them a particular shout out on the podcast, because they're the people that are touching and meeting the people that we're trying to reach on a daily basis. You mentioned family resource centres, and those community-based supports are way more likely than the health service often to have the relationships and touch points and trust to be able to impart, you know, some of those positive psychology tips in a really impactful way.
Just on a similar program in the Netherlands, it's called Eén tegen Eenzaamheid. It's a national program, which means Together Against Loneliness. And it's a multifaceted program from the government, which has, among others, a sort of national map where you type in your postcode and you say how far of a radius of kilometers you're interested in looking at. And it shows all sorts of community-based initiatives that you can participate in, how to get in contact with the person, is there space? And originally it was designed for older people, but it's actually extended to the whole population, especially during COVID-19. And this can be interventions like going to a neighborhood clubhouse that's available and on Tuesday nights to, I don't know, play a board game together. Because of the increases in energy costs in the Netherlands over the past few years, they've also had things called warm meetups where they would heat up a community center extra. Then people could just come and have a meal there, read a book, exchange ideas, etc. It can also be things like in some of our supermarkets, we have something called the kletskasse, which is a special line, in a cashier line, where it's a bit slower and you can have a chat with the person working behind the counter. I've used one of these myself recently. I was just curious how it worked, and if it really indeed goes slower, it does. And the person's paid extra attention to asking me how I was doing. That's kind of nice.
So
and this
pro-social things.
Exactly. And these are perceived qualitatively as enormously helpful by the community. But what we don't have yet is really a robust evaluation that shows how this impacts mental health outcomes. So that's the next step, actually.
Yeah, and I suppose just to your point, Fergal, on the role of the voluntary and community sector, like we certainly saw that through the delivery of the Minding Your Wellbeing programme. You know, they're the people that are working with the older people who have a sense of those that are socially isolated. They were able to arrange transport for the older people to come to the programme. And it just, like, I suppose for us, it was that kind of sense of, you know, working with community, the community and voluntary sector is absolutely vital. And we're very fortunate in Ireland to have an incredible community and voluntary sector. So that, you know, collaboration and working together is so important for mental health.
Often I think that the community and voluntary sector they're a mental health workforce that doesn't have the name tag mental health workforce, but they know it.
Absolutely.
And their communities know it.
Yeah.
So it's kind of that implicit action and support. And as you said, they know the issues that are in that community. They know, and sometimes the determinants, like you just mentioned, transport there, they know these other issues. They know poverty, what it looks like in their own backyard. So like you have to tailor your talk. It's no good talking over people's heads about positive psychology if you don't know what the granular issues are in the community about the bus stops and the footpaths and the schools and crime and whatever. Soile, did you want to come in on that point?
Yes, about these elderly people. We have this good practices circle for friends. And this was Laura's familiar. It's for elderly people,
Yes.
and it's evaluate, and it's very, very effective model, and it's based on old people's own circle, the friends. They can get new friends, and it's a certain model. So it was selected on EU countries' good practices. And because we are a small nation, we do a lot of international cooperations. That was the one.
And it's such a simple
example.
thing, isn't it? For somebody, I see my own mother-in-law engaging with, like what I see is like a social support group.
Yeah.
And she's, she goes there once a week, and then by virtue of being a participant in that group, she ends up doing the likes of catering for church events.
Yes.
And all of a sudden there's chats. Every one of those engagements is a social enhancement scheme that's free, and voluntary and life enhancing. And just like you were saying there, Laura, slowing down in the lane in your shop. Sometimes my kids laugh at me if I say something to this person in the shop because they're not used to people having conversations. Whereas like that was an older way of going, that we talk to the shopkeeper about the weather, about something else. It's just like get in, get out.
Yeah.
That's what they think. Like, how are you doing? Oh, are you finishing soon? Or what? What's the state of the nation? They're not used to that social engagement. You nearly have to model it. But the older people, giving them that opportunity, it's beautiful when you hear that coming off well.
It made me think in Canada, just as I'm listening to others talk about this and to you talk about it, that mental health promotion, sometimes we think has to be this complex process and system. And sometimes really simple things can have a really big impact. And I was just listening as you were talking, Alicia, in Ireland about work in connecting older adults through making these social connections. I'm thinking with youth, particularly coming out of the pandemic, we probably have so much that we can learn from our elders in our community. And that's something within our Indigenous populations in Canada that really cherish the elder knowledge and want to bring that into our learnings and understandings for youth and for families. And we sometimes lose that. And I really think that is a protective factor at both ends, that from a perspective of the life course and really bringing in older people, including myself, that maybe have and can teach the art of conversation in real life with people.
I just heard
the joy of that.
Yeah, that's a great example of it feeding into itself. We're creating a network of social engagement and enhancement. That's lovely. The Minister for Wellbeing yesterday was launching a football cooperative initiative, and we're in the middle of Men's Health Week here in Ireland. He had visited 3 men's sheds on Monday, and he said one of the men's sheds have a group of men that are, they're not producing any albums, but they can play musical instruments, and they can, but they're going in to meet older people in different residents and homes and entertaining them. So there's a bunch of guys, and they're not that young themselves, but they're taking that on, and you can just get a sense of that from that simple description. They're getting a life-enhancing experience, and the people listening is getting a life-enhancing experience. And it's this beautiful, positive circle of, mental health promotion, not using the term. Mm-hmm. So I take your point there validly that, we get lost in language. And I think mental health promotion, it's difficult. We spoke about it in our previous discussions about, getting political support for it. But we sometimes get lost in the language of it, don't we?
I think it is, Fergal. And I think that's probably common in the area of health promotion. What do if you tell someone you're working in health promotion, well, what's that? And how do you explain it? Because when people hear health or they hear mental health, they actually think of ill health.
Yeah.
So it's about focusing in on the health aspect and what makes us healthy. And I think sometimes, the focus is on problems. It's on, on the issues. But sometimes we need to bring it to that end of the continuum. And that's why I think it's useful to think about the continuum. that when we look at health and well-being, we think of in terms of promotion, prevention, treatment and recovery, and think about that in a circular way. You know, we go through life, we come in and out of these different areas, and it is worth investing in the promotion and the protective factors for good mental health. Because if you don't do that, you know, the services are just going to have to pick up more and more problems. And, you know, there's a big issue around that.
Yeah, no, there absolutely is. And you mentioned COVID there and the impact on youth mental health, but the impact on everybody's mental health. And I think one of the things that we've brought up a good few times across the podcast conversations that we've had is that COVID taught people to value their well-being. You know, but we now need to now what? Now we need to follow through on that. Don't just lie back into your old routine, you know, or some people have adopted unhealthy routines from COVID. You know, what can you do? What are the life-enhancing things that are going to, you know, protect your health and well-being?
Yeah, just as you're talking about that, about COVID helping us to value our own well-being, it makes me think, probably in Canada, but widely then, how do you take that momentum and turn that into how do we create thriving communities that can support our well-being? Because some of that's not just on us. There's other things that might be happening within our communities that are holding us back, that are not in our control. And there are other things in our community that can really support us moving forward. And so can we take that excitement, if you will, to taking care of ourselves and turn that behavior into something that is at a structural or community level that can really support people who want to make a change, but maybe there's other things, obstacles in their lives or in their communities that are getting in the way. And I think that's the real opportunity for mental health promotion as we move into what needs to structurally change to put this in our system. How do we make these programs, policies, just part of our life that you're not thinking about, I'm doing an intervention. Yeah. I often think in Canada, I've said this before sometimes, that I think it's successful when we start talking about a social emotional learning program, not as an intervention, because that sounds like we're testing something and which we are maybe sometimes, but how do we turn that into is just part of our program? It's part of our schools. And if you asked kids what they're doing, they're not, I'm doing an intervention.
Yeah, it's perfectly
I'm out playing
integrated.
Sports and I'm learning how to connect. And I've got to, yes, we do these programs in our schools and we don't really think about it. So I think for me, when you stop thinking about it as an intervention, that's the success that we're looking for as far as really scaling something into a structure.
Yeah, I just wanted to support what Stephanie was saying there about the structural issues. And I think, yes, mental health promotion can be about very practical, individual, everyday things, social connectedness. But the structural issues are actually also vital in terms of equity. So if you experience poverty, if you're experiencing homelessness, you're growing up in a hotel room, or you're growing up in a tent.
Yeah.
You know, if you experience discrimination, you're not valued, you're excluded. These have a really negative impact on mental health. And to address those factors requires a more upstream approach. And that's where the whole of government stuff is really critical, that we tackle those structural drivers of either good mental health or poor mental health, and to try and ensure that people have equal opportunity of the potential of good mental health to grow well. And that's where I think, a mental health lens on well-being is really important. Is how do you feel about yourself? How do you feel about your future and the world you live in? What you have to contribute, what you can receive and what you can give. So I think the structural elements, we shouldn't lose sight of those, because they're our living conditions.
Yeah, the living conditions. That's it perfectly. That's our bread and butter on a daily basis. They're going to be our barriers. And you raised some really stark examples there of different people's lives that are just fundamentally flawed and bleak in ways that are going to impact on their self-esteem and self-worth and everything. It is important to think about that. Alicia?
Yeah, I think as part of that, it would be really great for us to, I suppose, engage in a national conversation about our mental health and well-being, and what matters, what matters to us really in terms of our well-being. What is it that really influences our well-being, so that we can kind of, I suppose, see, at a national level, what are our priorities, and that we can perhaps focus in on, Is it loneliness? We know that housing is a significant issue at the moment. So I think that national conversation is important as part of this picture.
Yeah. And I suppose going back to the earlier point about mental health and all policies, we cannot begin to address it unless we, integrate that thinking. Isn't that what you're getting at?
That's right. Yeah.
Laura, you were talking about an example of trying to integrate that thinking earlier.
Well, first of all, I would like to invite you, Stephanie, to come to the Netherlands and to give us a training on how to move away from the word intervention, because we are very much an intervention-focused country. That might have to do with the language, but we haven't found an alternative yet in a simple way to use something else. So that would be very welcome.
I haven't found the solution either.
So sticking with the word intervention, I do think that I've noticed a lot of focus in the last few years due to the cost of living crisis, energy increases, of course, the impact that wars are having on our economies and the shift that's ongoing there. There's a lot more focus on the impact of income on mental health, which many of us who have been working in this area of research for years know plays a substantial role in our mental health. And there's a bidirectional relationship between both income and mental health. And what I've been trying to do in discussions with our ministries of employment and social affairs, but also our Ministry of Health, is to frame interventions or policy measures focused on income as a mental health intervention. And that's not something they might think of, but I'm saying, look, if you're taking away some of the income support policy measures in your country, that's going to have an impact on mental health outcomes in a negative way. Conversely, if you're going to invest in better policies for paid maternity leave, basic income, so to speak, less stringent criteria for how to get unemployment benefits, this is also going to impact mental health. So you are actually working in the mental health space. And something that I think in the Netherlands that has been sinking in, to the extent that there are a few experiments in a few cities now, one in Arnhem about taking away the debt of a certain number of community members completely. And in 3 other cities, that's Zaanstad, Tilburg, and Amsterdam, they're focusing on experimenting with basic income, and mental health outcome measures are a part of their evaluation for the first time. Usually it was an afterthought, but now it's actually one of the primary measures, because we know that these types of cash transfers, basic income, minimum income, whatever you want to call it, does have an impact on anxiety levels, on stress levels, on a sense of autonomy, on shame. So I'm really
on family dynamics
excited to follow this and how that's going to
interesting.
develop in the coming years.
That's really exciting to learn about that. Yeah, that's a great example of, I guess, the social determinants, really getting those measures in. Thanks for sharing that. So there's a variety of programs, and I know, Alicia, here in Ireland, that we try and target priority groups in priority settings. And social prescribing is one of the initiatives that we've actually seen a lovely upscale in investment. We keep talking about upscaling things. We have seen some upscale in relation to the delivery of social prescribing. Do you want to tell the listeners about that?
Absolutely. We started with social prescribing. It's one of our flagship programs in mental health and wellbeing. We started with it, I suppose, back in 2012. Our first service was piloted in Mayo. And as of the end of last year, we have 48 social prescribing sites across the country, 19 of which are delivered in our most disadvantaged communities in Ireland, in our Slunch Care healthy communities. And we have last year, over 5,500 people accessing the service. It's a freely available service to the adult population. And what we see is that over 64% of people that are accessing our service are being referred in for reasons of social isolation and loneliness. So we can see it's really addressing a need. And we're hearing this more and more from our GPs who are saying, that it's playing a really important role in terms of addressing some of those social determinants of mental health and well-being that, GPs don't necessarily have the time or resources to address.
Yeah, no, it's great to hear. We talk about, the model that Margaret spoke about and the promotion and prevention. But when you hear a GP saying, give me more of this and I can really help people and people can help themselves and we can build that capacity and ability. So it's great, as you said, that we're meeting a priority group where they're at. And I know that the traveller community in the HSE, we have a traveller health plan. But in terms of health and well-being and the traveller community, you've targeted them in relation to creativity and well-being as well.
That's right. We have a partnership between Creative Ireland, ourselves in the HSE and Health and Wellbeing, and the Arts Council, where we have over the last 2 years piloted a series of arts and creativity initiatives implemented with and by the traveller community. So it's about bringing artists together with the traveller community to work on these pilot initiatives. They've been really really impactful pieces of work in terms of really celebrating traveller culture through the medium of arts and creativity, and also approaching, and looking at topics of health and well-being with the traveller community.
Yeah, it's great. It's like one of the examples we mentioned earlier, that it feeds back on itself. Like it's the process of, travellers engaging in creativity and getting that opportunity, but then also bringing like that creativity exercise being a communication opportunity to others, both settled and traveller, about
Absolutely.
the traveller community, so it kind of builds strength from itself. Have you any examples from Canada, Stephanie, in relation to that Indigenous piece that you mentioned?
Absolutely. In Canada, First Nations, Inuit, and Métis peoples, our Indigenous peoples in Canada, have faced tremendous disparities and challenges with social determinants of health that include racism, the impacts of colonization, discrimination, and many other impacts.
Yeah.
And those challenges have led us down some unfortunate paths in our history, but there are also tremendous strengths and assets within Indigenous ways of knowing and how to look at community, elders, and community and culture as a protective factor. And in fact, how we can, as a federal government or provincial government, start to look at working with communities in partnership, true partnership, co-developing together, recognizing mental health promotion and community development as truly an underpinning of mental health that is not separate from other work. And I think there's lots that we can learn just from a national perspective from some of these learnings, where I'm thinking of some work that some of the First Nations communities have undertaken on a First Nations mental wellness continuum framework that has culture as its foundation, and that looks at wellness from 4 points of view, from creating meaning, creating hope, belonging, and purpose. And all of the work can fit, all of your life really can fit under those 4 areas, in my view. And it's a tremendous opportunity then
they sound better on a poster as well for the layman.
Than mental health promotion or interventions.
They do give very engaging construct, don't they?
They do. And they've been shown to be effective. And certainly within some of the programming that we're doing in public health, we are looking towards those types of programs and building those partnerships in a way in which these types of programs that support youth going back to land and learning more about their culture and history, and developing programs with elders as mentors and teachers, and respecting that knowledge and those traditional ways of knowing, and building up evidence in ways that are not necessarily a Western medicalized model, but show tremendous impacts on communities when they are done by Indigenous communities and supported through partnership.
Yeah, it kind of speaks back to some of the points that you made earlier, Margaret, about, if you've been discriminated against, if you've experienced racism, we have that experience, but in the traveller community in Ireland as well. And Martin Beans Ward actually spoke very eloquently on one of our earlier podcasts about his own experience. And, there's nothing more powerful to hear it from, the person themselves in the service.
In this work, too, is a way of looking at suicide prevention from a more upstream place that talks about life promotion and looking at not just suicide rates, but how we can live, how we learn to thrive, and, past survival to thriving. A number of the Indigenous populations in Canada talk about life promotion instead of suicide prevention. It includes, of course, helping people who are in crisis, but it includes something much broader and comprehensive in the way in which you can live and thrive.
We could talk all day here, but we have to wind this podcast up a bit. I really want to thank you all for your participation. But just before we close it off, I'm going to give everybody just a last word in terms of your hopes and aspirations around mental health. We're here in Galway. As Margaret said, we're trying to boost up. We're at a particular point in time here in Ireland. We're obviously trying to learn from our international colleagues. But give us a line or two around your hopes and aspirations around mental health promotion in the coming years in your own jurisdiction, or where you think it's going.
Yeah, in Canada, I think we are at the cusp of a tremendous opportunity for mental health and a comprehensive picture of mental health promotion, prevention, and treatment, that we're starting to look at things not in the silos. And we are creating structures that are starting to connect other sectors. And we're learning from each other and starting to listen better to our communities, various communities, even our Indigenous communities. And I think we have a tremendous amount to learn, and our ears are starting to open, which is exciting.
Great.
I'd like to see mental health promotion really central to our government agenda on health and on wellbeing, because we do have a wellbeing framework, and to see it very centrally to that, to see real investment in what works and what we know works and see that scaled up. And then I think to really also see a public demand for this, that it becomes a public issue. So if you have a public demand, the political will follow.
Yeah.
And I think COVID did improve that, but we need to just deepen that understanding at all levels, across policy, across the public, and maybe have that national conversation about what does good mental health mean for us, and how do we advance it. So we have a public demand, we have innovative policy, and that we have really skilled practice to support it. That would be my wish list, Fergal.
Great. Yeah. Thanks for that. Alicia?
I suppose with Stronger Together, our HSE mental health promotion plan, we're seeing it that mental health promotion is now being more embedded within our health service. So we can see more and more that mental health promotion is relevant to primary care, to our mental health services, to recovery. And I suppose, my wish is to see also the same being replicated in terms of a cross-government approach, that mental health promotion is relevant to many other government departments. So I think that's something I'm quite optimistic about. And I think the other part is the importance of monitoring and evaluation. I think demonstrating the impact of the work that we do in terms of enhancing population level mental health and wellbeing is hugely important. But I think also paying more attention to the scale up and sustainability of the work that we do in mental health promotion is going to be important.
Okay. Soila?
We have to make it mental health promotion integrated the whole basic daily lives. So it's invisible, but it's there because I'm realistic. So we also need budgeting.
Yeah.
We have money, and we have to perceive our political decision makers. We have to tell them what kind of actions we need, because they have to based on knowledge about our population, mental health state, and different kind of ages and so on, because there is a resource what they are. So we have to put more this promotion point of view than these services. They could be so large and larger if we don't do nothing. But we need also this impact assessment, more visible about what consequences is when we reduce poverty or homelessness and we take every child so no one get loneliness and so on. And it's not so simple to these figures and numbers, because when the election is coming, all politicians, they usually talk about services, how we improve services. We need wider point of view.
Yeah, I think
but it's possible.
It's possible, yeah. And you're nearly echoing some of Alicia's points there, that you need the evidence to build on the investment that you've got.
Yes.
Laura?
I would echo actually what you just said. So I think there's a lot of good momentum in the Netherlands to work on mental health promotion, and there's a lot of national and municipal level action taking place due to these policy developments over the last 2 years. But I would want to see, as it's a wish list, that investing in mental health promotion becomes the obvious choice instead of just the niche option of a few ministries or subdirectorates of ministries, that the spectrum from promotion, prevention, care and recovery, that we're part of the same team. So to really work more together and develop a strategy together, and more importantly, clear goals together and an action plan together. And last but not least, that in the Netherlands, we do have a lot of data when it comes to mental health from different monitors, from different longitudinal studies. But how can we use our science better to help decision makers in this next step if we want mental health promotion to be the obvious choice?
Okay, thank you very much.
I too would like to see mental health promotion embedded in a very visible way into our policies and programs. We've talked about it happening, but it being kind of invisible, and that we translate the knowledge, the evidence that we're learning in a way that communities can use. And I think that has been a challenge, that we have mental health in all policies. We have different frameworks and strategies. We have data. We have gaps in our data. But how are communities really putting that into practice? So it does start with making it visible, as Laura was saying, and then building it into a learning health system where you're continually checking, learning, and building the evidence in a way that people can use and understand.
Okay, I'd like to wrap up here, guys. I really want to thank you all for your contributions today. And I suppose we should call out that this podcast was made happen by a partnership between University College Galway, and the conference itself is a partnership with the Department of Health, Healthy Ireland, the Association of Health Promotion, and ourselves in HSE Health and Wellbeing. So thanks to all the partners, but also thanks to you speakers for giving us the time today and sharing your insights. And thanks for coming over for the conference. And thanks to you for tuning in to another episode of the HSE Talking Health and Wellbeing podcast.